Good afternoon or good morning. This is part two of a presentation about diarrhea in dairy calves. And today we're going to be talking about classification of calves with diarrhea. It's important to consider the classification when you're thinking about treatment. We'll be talking about treatment considerations and we'll have some take home messages for you. So let's get started. This is the Olsen family. In the middle, we have Dr. Merle Olsen, and on his side is his wife, Dr. Barb Olsen. On the side of each of them are their two sons, and to your far right is Samantha Olsen, who is married to Adam Olsen. So, what are we looking at when we have calves with diarrhea? First of all, let's look at the diarrhea score. The score of 0 is normal, 1 is semi-formed or pasty, 2 is loose, and 3 is watery. This chart is borrowed from Sheila McCurk, who is a real guru when it comes to calf health and neonatal diseases. And she has devised a very nice app specifically for iPhones. So if you're interested in it, please Google Sheila McGurk and try to find her app. Calves with diarrhea, we need to look at three things. We look at the amount of dehydration, we look at the attitude, we look at the eyeball recession, and we look at the skin tint. So attitude can go from normal to comatose and death. The eyeball recession, how deep are the eyes in the head, can be normal or can be more than 1 centimeter, 8 to 12 millimeter in their socket. The skin tinting is something I don't see done a lot, but I felt always that it was a really good tool. You pick up a little piece of skin on the side, on the neck, and lift it up and then count how long it takes for the skin to be back to normal. And to give you an example, when the attitude of the calf is depressed, the eyeball is in about half a centimeter, and it takes between 2 and 5 seconds for the skin to be flat and normal again. Then we're looking at a calf that needs intravenous fluid therapy. The treatment consists of several components. We have to restore the loss of fluids using the chart I just showed you. And I like to remind you that when calves continue to scour when you're treating, you have to kind of stay ahead of the game and think about maybe it's not that bad right now, but the way she's scouring, she will be worse in a few hours. We will be talking about the benefits of an anti-inflammatory therapy, the use of adsorbents, and last but not least, there are a few indications, and I stress the few, where antibiotics are really needed for diarrhea. Desired characteristics of oral electrolytes are listed on these slides. So key is that we have a rapid electrolyte uptake. And glycine is important for the transport of sodium and potassium and water. And it is important that glycine does not get degraded before the electrolytes are all used up. The product has to contain a proper alkalinizing agent, and we'll address that in more detail in a few slides. We want a rapid dissolving of the electrolytes, and I can relate to that. I use electrolytes. I am somebody who likes to do road bicycling, and some of the electrolytes I have, they don't dissolve. So when the bottle is empty, you see the electrolytes I paid for and wanted to drink are still at the bottom of the bottle. The components should not degrade. Glycine is an example of that. And a nice flavored solution will be met with the calf by the calf with a lot more enthusiasm than something you have to force down their throat. So I have here the acetate and propionate as the alkalizing agents of choice and bicarbonate on the right. You'll see when you go down that acetate and propionate help getting the sodium and water in. They produce energy when metabolized, and they don't alkalinize the apomesum. And why is that important? Because when we have an E. coli or a salmonella issue on your farm, it's important that the apomesum will be able to maintain the pH at which E. coli and salmonella are able to get killed off. And last but not least, acetate and propionate, unlike bicarbonate, does not interfere with milk clotting. This slide I just like you to have a look at without me talking, because it basically tells you the same thing. Look at the benefits of acetate and propionate, and even though bicarbonate has been used in a lot of old farmers' concoctions, really it is inferior to the use of acetate or propionate. So now I'd like to speak about osmolality a little bit, and osmolality becomes really a critical issue when calves have diarrhea. When you're healthy and up and around, osmolality can be overcome, or too high of an osmolality can be overcome. But if the calf has already diarrhea and has a compromised intestinal tract, osmolality becomes a big issue. So to give you an idea, whole milk and most milk replacers are sitting between 275 and 300. High protein milk replacers, 25 to 28% protein, are a lot higher. They can go over 600. Electrolytes, as you can purchase, generally have between 350 and 400, while high energy electrolytes, something I don't really think a dairy farm should really have to apply, can be over 700. I'd like to speak in a few slides about the danger of exceeding the osmolality over 600. The next slide, again, is for the people who are really liking to have a visual perspective, and you'll see the blue line in the low range, and the high range is the red line. And you'll see that high energy electrolytes can be as low as 650 and as high as 700. The main difference between high energy electrolytes and regular electrolytes is, yes it is, dextrose, your sugar source. So what are the dangers of high osmolality feeding? It's the slower apomesal emptying, so calves may appear bloated. It can cause bloat and may worsen diarrhea because a high osmolality may attract fluid into the intestinal tract rather than getting the fluid into the animal. And it may disrupt the tight junction of intestinal cells, commonly known as causing leaky gut as a possible outcome. So my conclusions are: never feed milk with high energy electrolytes, and never feed any electrolytes with high protein milk replacer. If you need to feed electrolytes with these rations, they need to be given as a separate meal. And I will show that in a few slides that is a practice we recommend, period. Solvet has been able to improve on existing products, and they brought out an electrolyte with an increased or an improved solubility, a product that saw reduced crusting and caking, and a silica powder that was added to slow down the degradation of glycine. It has a flip top container for their 2 and 4 kilogram pails. The advantage being they close and open very easily. So unlike other products where this lid doesn't really fit well, where the electrolyte bucket becomes a haven for flies, the easy to open and close lids will keep the flies out. It's a very palatable flavored product, and as we will see, it has no interaction with meloxicam, an anti-inflammatory, or with activated charcoal, an absorbent. This is an example of a feeding scheme. Remember, I said when you use electrolytes, it's better not to feed them with other products at the same time because you like to control the osmolality. When we use the electrolyte solutions, the oral electrolyte solutions marked as OES, we recommend an extra feeding. And I can see some of you think already that is not going to happen on my farm, but I like to point out that taking that extra step will pay off. You will see your calves get back to health sooner, and you also will see that your mortality will probably be reduced. If calves do not want to drink the electrolytes or their milk, one way to do it is to reduce the meal size and increase the feeding frequency, and if needed, to tube feed the oral electrolytes. In general, we recommend to give oral electrolytes for up to 3 days, and it has to be offered until there is no sign of dehydration or diarrhea anymore. Ideally, you do not go beyond the 3 days. Anti-inflammatory drugs are going to be a real help when treating a calf with diarrhea. We have listed on this slide a few of the benefits, and I will get into those benefits when I'll discuss the paper that was published several years ago. This paper, published in the Journal of Animal Science, looked at the use of meloxicam, an anti-inflammatory, versus a negative control. The interesting thing is that there was no mortality, no dead animals in the meloxicam group. They consumed their daily milk faster. They consumed the starter ration better. They consumed the ration at greater rates. They drank more water, remember the fresh water. They gained weight at a faster rate, and they weaned earlier. So what about meloxicam oral suspension? As you are aware, there are other meloxicam presentations, the injectable ones. So the meloxicam oral suspension has as a benefit that you receive higher and longer levels of protection. The bottom line for you, and I would advise to talk to your veterinarian, is that when you use oral meloxicam, looking at the levels here, the dark, the solid line, the levels are as such that it is really not needed nor recommended to retreat with meloxicam oral suspension for at least 5 days in dairy calves. A study what was published in 2020 was looking at the use of meloxicam oral in scouring calves and if it was making a difference if the drug was presented either by itself in the mouth, in milk, or fed in the electrolytes. The interesting thing about this study was too that a lot of pharmacokinetic studies, a lot of studies that look at the levels of the drug in the body are done in healthy animals. This study was done in calves that were actually scouring, and they had rota and cryptosporidium. When you look at that, You see the blue line again is the injectable meloxicam, and the three other lines are meloxicam oral in different presentations. The blue line, the red line is the meloxicam directly given in the mouth. The green line is the one given in the milk, and the purple line is the meloxicam given into electrolytes. As you can tell, there is very little difference, and so again, when you discuss it with your veterinarian, it would be a good topic of discussion because the advantage and the ease of giving the meloxicam oral in an electrolyte solution or in milk is considerable. Activated charcoal. One of the things about activated charcoal, granted that it is messy, is that it has an enormous surface area. Actually, 1 teaspoon of activated charcoal has a surface area greater or equal than a football field. And Solvet is conducting currently a study to look at the cited efficacy against Cryptosporidium parvum, a major cause of diarrhea in dairy calves. So the advantage of the activated charcoal it's binding microorganisms and it's binding toxins. This is a brief review of 2 studies where we showed that the non-specific binding for toxins, bacteria, viruses, and Cryptosporidium are demonstrated, and the literature clearly shows that it is useful for removal of some of the toxins associated with E. coli and the E. coli bacteria themselves. When you look at the figure on the right-hand side, you see the capacity of activated charcoal to absorb Cryptosporidium. So as little as 10 milligram of activated charcoal was able to reduce the number of oocysts quite significantly, as you can tell on the right-hand side of your slide. Activated charcoal is used a lot in calves, and when you talk to fellow producers, you'll see they use it for scours when they don't know what kind of scours they're dealing with. They use it in apomazal ulcers. That's of course a suspected diagnosis. They use it for cryptosporidiosis. They look at for calves that are not thriving well. They have intermittent diarrhea and bloating. They use it in coccidiosis, and some people, and we come to that again, is they like to use charcoal when they use antibiotics. Kaolin pactate is older than I am. And it is a product that meets the requirement for natural or organic food production. It is an aid in the treatment of scours, and it soothes kind of the gastrointestinal membranes. It helps in the removal of the toxins, and it is easily staying in suspension. It's easy to use and quite palatable. However, if you use it for several days, and the calf is not improving, I would advise to contact your veterinarian and get a perspective on the treatment or maybe the cause of the diarrhea. I mentioned that I was going to be talking about antibiotic, and I like to talk about cocci boluses, and I think that is where this bolus has a good place. It contains sulfametazine, and sulfametazine has been proven to be effective for controlling coccidiosis. The boluses can be used alongside electrolytes, charcoal, kaolin, and they can definitely be used alongside meloxicam. So what about the treatment of the calf scours? And what about the role of antibiotics? The key is to start treating early. So to our right, we see a scouring calf, and when she has a score of 2, so the score of 2 is not yet watery diarrhea, but severe diarrhea already, nevertheless. Oral electrolytes, anti-inflammatory drugs, and absorbents are the recommended route to go. So when are the antibiotics necessary? One thing to do is take a temperature. The other thing to do is look at the actual scours. Is there blood in the scours? And the slide I will show in a few minutes will take you through the process of evaluating the calf in all the different stages. So the cause of the diarrhea can be nutritional, crypto, rota, corona, maybe even E. coli. But again, that depends on the age of the calf, and it's always a good time and always a good idea to do some additional diagnostics. So the guidelines for the treatment of calf scours, again, I would like to send you back and look at the app from the University of Wisconsin. The guidelines are you use electrolytes until the diarrhea subsides. The calves certainly do better if they continue their normal milk or milk replacer ration. The milk and the milk replacer have a lot of good nutrients in it, have a lot of energy in them, and they do better, as proven in several studies, as compared to animals that are taken off milk or milk replacer totally. So feed only small amounts if they don't consume their full ration. The oral electrolytes can be tube fed if needed. And again, as a final point, I do not recommend the routine use of high energy oral electrolytes because feeding milk is a much better source of energy. So, as we saw in the previous slide, feed electrolytes as a separate meal. When you think about feeding electrolytes, think about the fluids that have been lost already and the fluids that will be lost in the next few hours. The guidelines, when you have a score of 2, you give 2 liters at midday. When you have a score of 3, having a watery diarrhea, you feed 2 liters electrolytes at midday and mid-evening. Always include an anti-inflammatory drug. Consider the benefits of adsorbents and the antibiotics, again, only warranted if the calf has a fever or is showing sickness signs or has bloody diarrhea. I like to take you to a flow chart about calf scours. So we start with looking at the diarrhea score. Again, 1 is normal, semi-formed, 2 loose but stays on top of the bedding, and 3 is really watery, sifting through the bedding. So on the left-hand side, you see the green bar. That's good, normal manure. So keep an eye on it. Score 1, semi-formed. Let's see, is he drinking well? Is he active? Is she looking good? On the right-hand side, we have the abnormal manure, and treatment will be necessary. So we're looking here at the abnormal manure. So in other words, calves with a score 2 or 3, and we're going to do a rectal temperature measurement. So we have on the left side the temperature lower than 39.4, and the calf is bright and responsive. So 3 reasons why not to use an antibiotic. So no antibiotic warranted. So we're going to now assess the hydration, the suckle reflex, the mouth temperature, and the ability to rise. And we're probably going to go with the electrolytes, the non-steroidal treatment, and the absorbents. However, if the calf's temperature is over 39.4 or is sick or depressed, antibiotics may be warranted. And again, since it is an antibiotic, consult with your veterinarian and decide on an appropriate protocol for your production facility. So we had at the bottom on the last slide that we were going to assess the hydration, the suckle reflex, the mouth temperature, and the ability to rise. Now we're going to look at the eyes. Are the eyes not recessed or are they recessed? Is the mouth still warm? Is the calf able to rise? Then we're going to go with the oral fluids, and with the score 2, we give 2 liters. With the score 3, we give 4 liters, in addition to the normal milk and in addition to the anti-inflammatory meloxicam oral solution. On the right-hand side, we have eyes that are a little deeper in the socket. The suckle reflex may not be as good. The mouth may be cold, or she is weak and unable to rise. These are the type of animals I suggest you consult with your veterinarian, look at your protocol, and it may be that IV fluids are necessary. So, what are our take-home messages for today? Treatment is not what we really like to go for. We like to focus our attention on prevention of scours. So I'd like you again to look at all aspects of your colostrum management, and again realize the devil is in the details. It's really important to look at the little things you can improve what make a big difference. Talk to your veterinarian, talk about evaluating your treatment protocol. Don't take calves off milk. Extra feedings with electrolytes are needed, and that is a great practice. And when you get used to it, yes, it is a little bit more work, but it will pay off. Anti-inflammatory medications like meloxicam oral suspension help recover the calf quickly. I would like you to take advantages of new diagnostic and monitoring tools. We talked about that in the first presentation. And we need to keep good records and use those records to make better decisions. Please only take down the records you feel that are important for you to make decisions. Sometimes records are really becoming a big book full of data, and it is written down so you feel good about it, but you don't use it to make better decisions in the future, and that should be your goal. Use antibiotics only when needed, and we talked about those indications, and the majority of the calves with diarrhea, I would like to leave you with, are not in need of an antibiotic. So I'd like to thank you for your presentation, and please feel free to contact Solvet if you have any questions on the presentation or you would like to learn more about any of our products. Thank you very much.